I think we've got most of our participants now, so we will jump in here to this first uh, slide around what this webinar is and isn't. So if you are coming here today for some information, some validation, clarity, that's great. You're in the right place. What this webinar is not today is a diagnostic assessment of any kind, a treatment prescription of any kind. Um, and of course, it's always important that you speak directly to your medical provider. However, we have some fantastic professionals here to give their knowledge to us. Before we dive in, we do need to give a bit more of a disclaimer though, so I'm just going to do that briefly and then we'll head in. So the information shared in this webinar is just for general educational and informational purposes only. It's not medical advice, a diagnosis, or a treatment plan, and it's not suitable for professional care from a licensed healthcare provider. By attending or submitting questions, you are not entering into a therapeutic relationship with Cognito Health or any of the presenters today. By continuing to attend, you acknowledge and accept this disclaimer. If you prefer not to, you can simply leave the session by clicking Leave Meeting at the bottom corner of your screen. And finally, if you are in a crisis or need immediate support, please contact your local health and emergency services or a trusted mental health care provider right away. All right, so today I am joined for this late diagnosis adult ADHD without the shame webinar by Fran. She is our nurse practitioner and a diagnostic practitioner here at Cognito Health. As well, I've got Katelyn. She is a CBT care provider here and an ADHD skills coach as well. And then we have Trevor joining us. He is a former Cognito client and has been through the ADHD assessment process as an adult. So for those of you who are new to Cognito Health, we are an all-in-one virtual mental health service. We operate right now in BC and Ontario, and we support people who are 17 years or older experiencing mild to moderate anxiety, depression, insomnia, and of course, ADHD. We believe in high quality mental health care and that it should be accessible, affordable, and immediate. We've worked with lots of clients, thousands of clients, and we are on a mission to bring clarity and compassion to the mental health system here in Canada. Being an all-in-one service, it means that we work from a team-based approach with the medical and therapeutic providers so our clients can access things like diagnostic testing, medication, and then that one-to-one CBT skills-based therapy, and as well as group therapy, all in the same place, all from the comfort of your home. And I wanted to take a moment to just give you kind of an idea of why this conversation even matters. Where did it come from? Why did we develop this webinar in the first place? And that's because we really identified a need for more clarity around specifically adult ADHD, like how it's diagnosed, what treatment options you have, and then how to navigate the kind of social perception of being diagnosed with ADHD beyond childhood. Ultimately, we know as a company that information reduces fear and discussion reduces stigma. And so we wanted to develop this webinar to do both of those things. Our goal today is really to empower you to feel informed and confident when either discussing or making decisions about your own ADHD journey. There's no expectation to pursue a diagnosis here today. There's no expectation to pursue treatment. It's just about understanding and demystifying this adult ADHD late diagnosis thing that so many people are experiencing. So without further ado, I'm going to pass it over to Fran, and she is going to kind of clarify what ADHD is and demystify this diagnostic process for us.
Thanks, Anna. So I always like to start off with the definition of what ADHD is, because I think that that is really important. It is a neurodevelopmental condition that affects executive functioning. And I think when I see clients at Cognito, sometimes they come with some judgment, I think, from people around them that ADHD is due to a lack of willpower or of not trying hard enough, and that's not the case. This is because this is a condition that becomes more evident as the brain develops, which is what neurodevelopmental means. And it does show real differences in brain structure and chemistry, and it affects executive functioning. So in this slide, you can see the different components that are involved with executive functioning. And one or more of those are impacted because of when one has ADHD. ADHD presents in three different ways. There's inattentive, hyperactive, impulsive, and combined. That's especially relevant, probably less so when we're looking at pharmacological treatment, but I think when we get to the portion about skills building, that presentation is a really important thing to think about. So next slide. In terms of demystifying the diagnosis, one of the things to realize is that ADHD is actually under the umbrella of something called a clinical diagnosis. So there are some diagnoses that we make as healthcare providers that are quite evident that can be diagnosed with a lab test or imaging. So for example, if you have low hemoglobin and low iron stores, you have iron deficiency anemia. ADHD is under something like clinical diagnosis, which means that you need to have someone who's skilled and licensed and trained to be able to make that diagnosis and come with all the interviewing and the skills to make that judgment and diagnosis. So we do have some guidelines, especially from CADRA and from the Psychiatric Association, so the DSM, to help us make that diagnosis. And so in order for someone to have ADHD, they need to have at least 5 symptoms. Those symptoms need to have been around for at least 6 months. They should have first been evident before a person's 12 years of age. The symptoms need to be present in at least 2 settings. So whether that's work, home, social, school. And these symptoms need to impair function. And even with that, we need to make sure that these symptoms are also not better explained by another condition. And so that's why sometimes a diagnosis of ADHD can take several appointments to reach. With Cognito, when someone signs up for the diagnostic process, there's an information gathering that involves filling out a lot of forms. And we do appreciate that if you have attention dysregulation, that can be challenging. So we're fortunate to have a patient navigator that helps do that. The next step is meeting with a nurse who kind of helps organize all that information and do a medical history review that would look at are there other conditions that could be contributing to this? And then there's a 45-minute interview with a nurse practitioner where we pull all this information together and really talk to clients and see, is this a diagnosis that we are reaching? And so from that, once the diagnosis is made or an alternate diagnosis is made, the outcome and treatment recommendations come from it. So next slide. This just talks about what we assess, and that's to ensure that we're meeting the points that are in the guidelines. So looking at history of symptoms, where do they occur? Does it affect functioning? And is there consideration for other conditions that could also be impacting attention, which it could be anxiety, depression, trauma, and insomnia, as well as physical causes like thyroid and hormonal changes that can affect that as well. So next slide. Post-assessment, there's, if you have a positive ADHD diagnosis, and I think one of the reasons that I love working for Cognito as much as I do is that it is about pills and skills. And Katelyn will talk a little bit more about that in the following slides, but it's just so important. And the research really shows that pharmacology is important, but so is the skills building. The two of them go hand in hand and really optimize the treatment of ADHD. So we do provide medication. We have CBT therapy and coaching for lifestyle changes. If the diagnosis is not looking like it's ADHD, we do have to then be able to align to other resources. There are some anxiety and depression that we can also treat at Cognito. And sometimes there we can end up in a situation where the diagnosis is not clear. And so we're really lucky that we have psychiatrists that we can then consult with and then get back to patients too to say is what the diagnosis is. So I'll turn it over to Katelyn from there.
Thanks, Fran.
Hello, hello, everybody. As Anna mentioned earlier, my name is Katelyn. I'm a CT provider here at Cognito. And yeah, I'm going to be talking a little bit about adult ADHD a little more and really why so many people are now questioning it later in life and also talk about what people can really expect through the assessment process, because I know it can feel like a lot to walk into, to say the least. And honestly, for myself, I think I would have loved to have a better lay of the land beforehand, and not just like process wise, but also what to expect emotionally, because yeah, it can really be quite the roller coaster. So, to start off, we're going to talk about why so many adults are beginning to question ADHD right now. Because for a lot of us, ADHD was never on our radar growing up. For a lot of people, they didn't fit that hyperactive stereotype that we tend to associate with ADHD in kids. And yeah, for a lot of us, school was pretty fine. Like grades were fine, relationships were fine. So there weren't really any obvious huge red flags for the adults in our lives. And now, with so much research on how differently ADHD can present from person to person, we know that a lot of it simply went unnoticed. And it's often not until entering the adult world that things start to feel a lot harder and we start to question these red flags that are coming up, because suddenly gone are the days of these rigid structure of childhood. There's no one setting the schedule, there's no one reminding you what to do. Suddenly you're the one managing everything and making all of the rules. And that's when people start noticing some challenges for sure. And it might look like starting 100 tasks all at the same time and somehow not finishing even one of them. It can look like procrastinating things that you actually really care about. Maybe it's zoning in and out of conversations, even forgetting things that like actually really matter to you. And with more awareness now than ever through social media and education, people are seeing themselves reflected in ADHD in a way that they never did growing up. So it really starts to shift from super self-critical thoughts around being lazy or not good enough to thoughts around, okay, wait, maybe there's actually a reason for this. And we can go to the next slide. So, yeah, when we grow up without that understanding, it's really common to internalize a lot of shame. A lot of people develop a very harsh, brutal inner critic, almost as a way to function. The voice might sound like, why are you sitting down? You're being so easy. You should be doing more. It's not that hard. Just get it done. Everybody can handle this. And for a long time, that becomes a strategy, basically berating ourselves to get things done because other productivity tips don't quite cut it, like at all, really. But over time, that really mean inner voice becomes exhausting, but it can really start to impact your mental health. And what's important to understand is that ADHD is not laziness. ADHD is a brain-based difference that impacts how you regulate attention, motivation, emotion, and energy. So it directly affects your ability to start tasks, stay focused, and actually follow through. And I'm talking like even on things that you actually really care about. So when people start learning that, it can shift the relationship that they have with themselves. But at the same time, when we're questioning, like, okay, maybe I have ADHD, there can also be this fear of like, what if I'm just looking for an excuse for my behavior, an excuse for being lazy and not good enough? And I just want to like take a second to really normalize that. I hear that all the time. Honestly, I hear that almost every day, even from people who actually do have a full legitimate diagnosis. They're like, what if this is just an excuse and I've like tricked all of you into thinking I have ADHD? So, yeah, I want to say that doubt is a very common part of this process. And something people don't really warn you about is that this process can be quite the emotional roller coaster. And I'm talking like before, during, and fully after the diagnosis. Before diagnosis, often there's a lot of fear going on, like fear, what if it's not confirmed? Like, what if I go through all of this, the appointments, the fees, the forms, and I still have no answers for what's going on? But also, there can be fear that, like, it will be confirmed, and that can feel very real and very permanent. And during the process, there can be so many moments of validation, even in just being like asked the standardized questions through assessment, like, wait, other people experience exactly the same thing as me. And to the point where standardized questions have literally been created around it. But it can also feel extremely overwhelming with all of the forms and the appointments and the fees. And then after diagnosis, there's usually a mix of relief and validation, like, okay, there's actually a reason things have felt this hard. And maybe I can get support that will actually work. But alongside that, usually there's a lot of grief, like looking back, wondering what might have been different if you would have known earlier, or what support you might have needed and didn't get. Or even some people notice more shame come up, feelings like, wow, my brain isn't normal, and this is just how it's gonna be for me. So, really, this process kind of becomes this re-understanding of your past and getting to know yourself on a deeper level underneath all of the masking that you've likely done your entire life. And those complicated, messy mix of feelings is entirely normal. From there, when it actually comes to support post-diagnosis, like Fran was talking about, medication is definitely one tool, but it's not the only tool. And research really shows that the most effective approach is actually a combination of skills and medication. So outside of medication, there's a lot that can actually be really life-changing. Like for instance, things like even just learning how your brain actually works through psychoeducation, also building skills that are actually designed for how your brain functions, like through CBT, for example. It can look like support with emotional regulation, executive functioning strategies, creating systems and environments that actually work for you instead of fully against you. And also things like lifestyle adjustments that support your energy and focus can be actually life-changing. But beyond that, human connection, whether it's therapy, support systems, or just having people you can talk to about life that actually understands is huge. Um, but yeah, a lot of people have been trying to force themselves into places and strategies that were never designed for them. And when support is actually aligned with how your brain works, that's when things can start to feel a lot more doable. And this is the part of the process where things start to feel empowering. First off, huge disclaimer, ADHD does not define you. It's a part of your experience, but it doesn't change who you are as a person. For many people, getting a diagnosis later in life is actually the first time they start to get to know themselves without all of the masking. So there's this process of now building self-awareness and understanding, figuring out how your brain works, what you need, what actually helps. And one of the biggest pieces is now actually having the language to describe your experience. Because when you can understand it, now you can communicate it. And that can improve your relationships, help set expectations and boundaries, and help you advocate for yourself in an actual meaningful way. And I think it's really important to highlight the strength that comes with ADHD. Honestly, personally, they're probably my all-time favorite clients. ADHD brains are just so sparkly and often wildly creative. They think outside of the box, they're innovative. These are typically the people in our communities who are the innovators, the creatives, the problem solvers, and the go-to people in a crisis when everything's burning down. So the goal isn't to change who you are. We need who you are. It's more to understand your brain, your strengths, work with it, and build a life that actually supports you. And with that, I'm going to pass it over to Trevor to share more about his personal experiences with Cognito and kind of like life beyond diagnosis.
Thank you, Katelyn. You raised some really important points there, and I hope our viewers uh, take what you need from what she just said, take it to heart. It's really important that you recognize that this is not a defining diagnosis of who you are, your character, your personality. This is just part of your experience, and there are ways to absolutely work with it. So thank you so much, Katelyn. And yes, Trevor, let's pass it over to you to hear some real life experience from someone who's walked this path.
Yeah, well, thank you for having me, and appreciate everyone dealing with my slight tardiness, or at least my first part of the call. I was in a car and maybe talking about on the pre-diagnosis side, and I think this is actually a really great segue, is that the ADHD brain actually doesn't do a great job or doesn't perceive time maybe in the same way that maybe a more neuronormative brain does. So I think this is a perfect example, is that I thought I had all the optimism in the world that I would get to my desk at the right time, at the right place, knowing that this is important and knowing that, education about ADHD is something that I truly value. And somehow I still didn't make it to my desk on time. And with my pre-diagnosis, I think a lot of people who were in my life, in my community, would say that I'm disrespectful or that what's wrong with me. But I have started to give myself a bit more grace to understand that my brain may just not work the exact same way. So, what I'm going to talk about pre-diagnosis is that there was just some unknowns about why I was doing some behaviors that may have been viewed as self-sabotaging to others, or were challenging for me, that I just didn't really understand how my brain worked. I knew that if I could name the behavior and the action and maybe why it was happening, that could really help me moving forward. So, when the suggestion of potentially getting an ADHD assessment was a possibility, I really jumped at the opportunity, because in and I think that it was really well discussed by some of the other parts of the Cognito care team, is that you can do quite well with ADHD undiagnosed. Something that an ADHD brain loves is urgency and novelty. And frankly, sometimes school can have both those things. If there's test deadlines and there's, the novelty of learning something new every single day, like these are actually parts of the ADHD brain that are really satisfied. So where it was starting to become more of a problem for me in my life was not actually even at the independent contributor level in the workplace, is when that I had to start completely managing my own time. So when it was at complete discretion of what if I was leading a team or myself, that became the more challenging part. Getting to the diagnosis, I think the team's done a really good job of outlining what does happen. And yes, I will say, as someone who has a diagnosed combined ADHD approach, getting 7 forms to fill out was daunting. And I will say the team did an excellent job of finding ways to remind you. There's tracking statuses. They are trying to work with your ADHD brain as best as they can to make sure that you can do this, and just know that like there is no tight timeline. Like, chip away at these. They're not fun, but they are, as Katelyn mentioned, super validating at times. So I will say that that part is really, really important to get done. And then the actual 45-minute assessment was life-changing for me. It was a really great opportunity for me to understand how my brain works. It really made me question what I put on a form. Something that was really notable on mine is that I was much more kind to myself in writing, but when I actually started talking about my experiences, they were actually far more severe than I was able to. So having that combined approach of like what I was writing down versus how I was speaking to someone was a really important way to get to my diagnosis as well. And then the last thing I want to talk about is post-diagnosis. So I think Katelyn did a great job of talking about the roller coaster. I think I really sat in my diagnosis for a little bit of like, okay, like I thought this might be the case, like this happened. I'm not going to do anything because I've been fine before, and I almost like had some resistance to like maybe opening myself up to different behavioral changes or getting to know myself even more. I think that I just was like, train stops here. I'm done. I've learned what I needed to learn. This is something I have to live with. And I was almost viewing my ADHD diagnosis as like a terminal illness that if I like didn't do anything wrong, it wouldn't get any worse, but it wasn't going to get any better. And I think that was like quite a shame to take that approach. And then I started talking to my therapist about it, and I noticed that it was like there were moments that were getting more validating. And then I actually switched to obviously a CBT approach with a practitioner that had a lot more experience in the ADHD space, which was really eye-opening to me. I was able to make different behavioral changes. I was able to start understanding my brain a lot better. And then after that, I had decided actually about 6 months after my diagnosis to try medication because although I was learning so much more about my brain, like I did feel like my life was really overwhelming in a way that maybe like for a neuronormative person wouldn't have felt that way. So a good example that was shared once is that sometimes changing tasks can feel like walking up a curb for some people. And the definition that was brought for someone who might have ADHD when switching from task to task, it felt like I was like jumping over a gym bench. So like although like both things are very much capable for someone who's healthy and happy and but like if you're jumping over 25 gym benches versus just walking up a curb 25 times, like you start to tire yourself out a lot more by the end of the day. So that's just a small anecdote that was shared with me, and I thought that was really helpful for me to understand of like how much more effort my brain was doing and what medication might be able to help with me with. So I think if you choose to ever get diagnosed, be kind to yourself in the process. Go at whatever timeline you want to. Like mine, I think I'm about a year out from my diagnosis now, and I think it's been really helpful that I chose when I wanted to go, when I thought I should go, take the next step. And so whatever works for you, you know yourself best. And I would just really push anyone who does either gets diagnosed or chooses not to or has ADHD or not, the more you can learn about yourself, read books. I strongly encourage just that self-discovery is incredibly helpful in the post-diagnosis process.
Awesome. Thank you so much, Trevor, for
Thanks.
sharing. Yeah, it's really important to talk about like the pre, the during, the after in terms of that experience, right? Because all of those phases can look and feel really different. While Katelyn mentioned there are some of those emotions that are weaved throughout them, they can look really different. And I think, Trevor, your story just shows that. So thank you so much for sharing with us today, Trevor, and Katelyn and Fran as well. We've got some questions, a little Q&A here. We had viewers submit questions prior to our session today. I wish we had time to answer them all. We don't. So we have kind of combined some of the more common questions or the themes, and each speaker is going to answer some questions here. If you have more questions after the webinar, there is a link at the end. You can actually book a free call with myself or another team member, and we can kind of answer more specific questions that you have specific to your experience. So watch for that at the end. But first of all, we'll head over to Fran again, and she's going to talk a little bit about the difference between ADHD, PTSD, and anxiety. And so I'll let you at it, Fran.
Thanks. So it's not even so much understanding the difference as it is what is the most prevalent cause for what a person might be exhibiting. And these are all really closely interrelated. So we know that an anxious brain that's always worried isn't really able to focus as well as one would hope. But at the same time, and this has been one of the big learnings for me in working with ADHD clients, is that People also experience a lot of anxiety because of ADHD, because they don't sleep, because they're worried about all the things that they meant to accomplish, but they didn't accomplish. And sometimes ADHD can cause depression and anxiety just as much as anxiety and depression can cause attention dysregulation. So a big part of this is just understanding that this is all interrelated. And it's part of the discussion that we have with clients when we're going through the diagnostic process of what should we try and impact first. A lot of times taking care of the ADHD will really make other symptoms better. Sometimes we need to address those symptoms and that makes the ADHD better. But it's very contextual and it's very individual. But that is part of what we spend some time in that 45-minute interview and afterwards as well, trying to untangle and build a picture of what's actually happening for people.
Mhm. Yeah, I think that's really important. That point that you made, Fran, is that, executive functioning, right? So what's the signs and symptoms that show up when you have ADHD? They also can show up for you if you don't have ADHD. So you might have trouble with focusing or task switching or time management, but that can be brought on by something like anxiety, depression, PTSD. It doesn't necessarily mean if you struggle with those things that you do have ADHD. So that's why the diagnostic process is also really important, is so that you can untangle those things, like Fran said, figure out what actually is going on for you. And if it's all of these things, all of the above, where do we start? What can we tackle first? And oftentimes, like Fran said, starting with the ADHD can kind of open the door to some healing and some progress in the other areas as well. So thank you, Fran, for sharing that. Next, we've got a couple questions for Katelyn. Again, some topics around ADHD and anxiety, but in this, we're going to kind of come from it from a CBT lens rather than a diagnostic lens. Take it away, Katelyn.
Yeah, thank you. So for the first question, how to identify ADHD from anxiety and what CBT techniques can help? Like Anna said, more so taking like a CBT approach to this answer. Finding tools that actually work for your brain comes with understanding your brain and how it works. So one thing that can make ADHD and anxiety really confusing is because sometimes they can look really similar on the surface. So both can involve racing thoughts, procrastination, overwhelm, or a hard time focusing. But understanding the why underneath can kind of shift the tools that might be most helpful. So, say with ADHD, sometimes those racing thoughts might feel more scattered or like there are way too many tabs open, if you will, all at the same time. So your attention is kind of getting pulled in a million different directions. Whereas with anxiety, something to look for when you're having those racing thoughts is that the thoughts typically tend to loop around the same worry or similar what if scenarios over and over. So ADHD feels more like mental chaos or jumping between thoughts, while anxiety may tend to feel more like getting stuck on one stressful thought or like what if situations. And what makes this even more complicated is a lot of people experience both. But part of the assessment process is really looking at that bigger picture. What's driving the difficulty, like Fran said, and in terms of CBT tools, a lot of strategies actually do overlap and also have like a widespread um, like way of helping reduce symptoms. So say things like breaking down tasks, reducing avoidance, building structure, challenging really self-critical thoughts, even emotional regulation. All of these skills can help not only with anxiety, but also with ADHD. But the approach can look a little different depending on what's coming up specifically for you. So that's when one-on-one support with a professional can really help individualize those strategies for you. So it's something that works for all the moving parts of your life, if that makes sense. Yeah. And otherwise, the second question, how do you manage ADHD without medication use? And what are some of the best strategies? That's a great question. And honestly, there's a lot you can do for ADHD outside of medication, especially with CBT tools. I know we don't quite have time to go through everything. So if I had to give one main takeaway, I feel like I honestly say this to everybody, systems over willpower always. Willpower is such a wildly limited resource. And when it comes to those of us with ADHD, it's even less reliable. So instead of just trying to try harder, it's about setting things up in a way that makes starting easier. So that might look like breaking down tasks into like really, really small pieces, or something like using timers, or actually like engineering your environment so you can rely on external structures instead of trying to rely on that limited resource of motivation. So things like making things more visible, reducing distractions, or setting things up ahead of time so the next step is really easy and obvious. Because again, the goal isn't to force your brain to work differently. It's more so to work with how it already works. And self-compassion honestly goes a long way here as well. A lot of people with ADHD, like we were talking about earlier, have spent years feeling like they're failing at things that seem to be easy for everybody else. So I would say like a huge part of this work is also learning how to support your brain instead of constantly fighting it into changing.
Yeah, so true, Katelyn. Progress made out of shame and guilt is often progress that doesn't stick for too long. So self-compassion is a huge part of this. All right, thank you so much for answering those questions, Fran and Katelyn. And for the last one, I'm going to throw it over to Trevor. We've got someone asking, how do we implement regular small dopamine hits throughout the day so that we aren't turning to unhealthy behavior? And I think Trevor has a really fantastic approach for this. So I'll hand it over to you.
Well, I will say that I do often get into some unhealthy behaviors at times, but I'm getting better as time goes on. So I think first one that I like to think about, I'm gonna answer this question in like outside of work and inside of work. So outside of work, I make any task. So I like to say that if you have ADHD, you have an interest-based nervous system. And once again, I'm not a medical practitioner, so take this with a grain of salt, but rather than an importance-based nervous system. So like I think someone outside of work might like want to take out the garbage because that would make them feel like they've done something that is not very interesting to me. So I definitely try to combine boring activities with little treats. So the treat would be for me is to like listen to a podcast. So anytime I have to do a chore, I will be listening to something that makes me feel like it's a bit more luxurious. I have suction cups on the back of my phone, like I don't know what they're called, like content creators use them. But and you can like basically put your phone anywhere so you can watch Netflix while you're like washing dishes or meal prep or anything that might feel a bit more boring. Just to give it a bit more context. So that would be my little small dopamine hits like outside of the day when I'm doing something that maybe isn't the most enjoyable. I try to like get some enjoyment in it. The other part that I've really noticed about my brain is that I'm like quite competitive. So timers are really great for me. So I have a very large timer that is magnetized. So I can like magnetize it to my stove or like I do it really close to my computer and I just set 20-minute time blocks and you'll be so surprised. It's very satisfying how much you can get done in 20 minutes. And then on the other side is that I do make a list inside of work that is non-dopamine and dopamine. So I do split up my workday that way. And I generally find my non-dopamine has a lot more, which is so sad. But at the same time, what I will suggest is being really honest with those timings on the things that you probably don't need to do, but you really want to do, and mixing them throughout your day. And the last one is that I always start my day with something really easy, and that will make me feel really good. So I think a lot of people are like, you should eat your dinner before your dessert. And I like to start my day off with like, a little something sweet. And so for me, that would be like, a more creative project at work that might not take a lot of time. And then that kind of feels like it's getting my brain going. And then I can get into something that's a bit more boring afterwards. So yeah.
Awesome. Yeah, I think that's such a clever thing, right? It's quite simple, right? To just pair a task that we have to do with something that we want to do, but that's where we introduce those little hits of dopamine throughout the day. And when we do that, it makes doing the stuff we don't want to do easier. And then, before we know it, our day is full of those things and we are able to better avoid the unhealthy behaviors. But I think, Trevor, what you said right off the top there, that we still do unhealthy behaviors, you still do them. That's so real. Like the goal here is
Yeah.
not to change 100% how you live. And we're human. We need those little comfort pleasures. Um, but to be able to access those other hits of dopamine throughout the day so that you can build on them and get those things that you need to do done. Um, that's the goal. So thank you so much for answering that question. Well, that brings us to the end here. We really want to just remind you that all of this information here should encourage you to feel informed, to feel validated that what you're experiencing is real. This is not laziness. This is real brain-based differences, and that there is support available. There are things that you can do to make your life easier, whether it's reaching out and getting a diagnosis, whether it's connecting with other people who just get it, whether it's reading a book, watching a webinar, learning about yourself and how your brain works. It can be really freeing, really validating. So remember, information is power. And we hope that we have reduced some of the shame or the stigma that you may feel with a late diagnosis of ADHD in your life. As I mentioned before, we do have this free 15-minute discovery session that we offer. So you can scan the QR code here on your screen, or you can always access it through our website at getcognito.ca. This is a option for you if you want to ask some more specific questions, things that are going on in your life, and you want to see if we could help. So we offer that now to people in BC and Ontario. As well, we also have some free self-assessments on our website for ADHD, anxiety, depression, or insomnia. You can hop on there. It's a quick little kind of survey, and then it will tell you, your symptoms are looking like this, or maybe it's this. And that just helps you start to gauge, where am I at? What's going on for me? And then if you wanted to do that first and then book a free discovery session, say, hey, this is what my self-assessment showed. What does it mean? How could I help, or how could I get help? That's the perfect combination of using our
Anna,
resources available. Yeah.
sorry, Anna, just to interrupt, I noticed that the QR code is not working.
Oh,
So we might just be able to email a link out after this.
yeah.
So look out for that.
Okay. Yes. Thank you so much, Armand. We will be sending an email with this recording as well, and we can include the links in there. Of course, you can always head to our website. Maybe Armand can throw the website in our chat, and people can head that way. But yeah, that's kind of all from us today. We really want to thank you for joining us. And please connect with us if you have any more questions, you want to know what kind of support is out there. We're really trying to make mental health care accessible and affordable, and we are always open to feedback on how to do that better. So please take a moment to fill out our feedback survey at the end of this webinar. And we hope you all have a wonderful afternoon and a wonderful rest of this week. Thank you so much to Fran, Katelyn, and Trevor for joining us today as well.